So before I came into the patient's room, the patient's height and weight and vital signs were all checked, all within normal limits. We also did the Snellen vision chart. Her vision was 20/40, meaning that what she could see at 20 feet, person with normal vision could see at 40 feet. She's alert and oriented and dressed appropriately for the weather, so I'm going to go ahead and get started. Hey, my name's Ashley Asher, your student nurse today. Can I get you to say your full name and date of birth?
Nicole Garto, 9/12/84.
Okay, well today we'll be doing a general head-to-toe assessment. It should be about 30 minutes long. Before we get started, do you have any questions for me?
No.
All right, well I'm going to wash my hands, give us some privacy, and we'll get started. Okay, so first thing, your skin. I see that your skin is warm, it's smooth, firm. You have good skin turgor. I don't see any lumps or lesions anywhere, so I'll do your capillary refill real quick. 1 to 2 seconds. 1 is 2 seconds. That's good. That's all normal. Lower extremities is 1 to 2 seconds. 1 to 2 seconds. Okay, that's all normal. So we'll go ahead and I'll get started on your head. Your head is normocephalic, meaning it's just a round shape, appropriate for your body. Let me know if you feel any pain or tenderness. I'm just going to feel around up here for any lumps or lesions. Anything?
No.
Okay, now lumps or lesions are present. Your hair is evenly distributed. It's healthy, it's soft, so that's good. Then go ahead and palpate your sinuses next. You should feel pressure but no pain. So please tell me if you feel any pain. Got your frontal. Any pain?
No.
And your maxillary? Any pain?
No.
Okay. So no pain or pressure with the sinuses. We're going to do your TMJ, your temporomandibular joint next. So I'm going to need you to open your mouth and close and open one more time. All right. So your TMJ, it feels, I didn't feel any crepatitis. Did you feel any pain or tenderness?
No.
Okay. So cranial, so I'm going to need you to clench your teeth. All right. I'm going to pull down against resistance. All right. So cranial nerve number 5 is intact. Next, I need you to smile, frown, puff your cheeks out, blow out, raise your eyebrows, and close your eyes tightly. Okay. Cranial nerve number 5 is intact. Next, we're going to do the light touch test. So I need you to tell me when you feel this. Just go ahead and close your eyes.
No. 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 No.
Okay, cranial nerve number 7 is intact, so that completes your face. So we'll go ahead and do your eyes. Just need you to come over here real quick. I'm going to go ahead and do your eyes and your nose and your ears over here so I can reach my tools. So for your eyes, I see that your eyebrows are symmetrical. Your eyes do not have a sunken in or a protrusion effect or characteristics or anything. I don't see any lumps or lesions or anything. So go ahead and look up for me. Okay, got your conjunctiva being pink and moist and your sclera is china and white. So we'll go ahead and do some eye tests real quick. First we're going to do the cover test. Just need you to keep looking over here. I'm going to look for any deviated alignment. Okay. All right, that's good. So your eyes didn't try to fix or anything, so that's good. Next we'll do the confrontation test. Just going to need you to put this card over your eye. I'm going to put one over my eye, and I just need you to tell me when you see my fingers, okay?
Okay. Now. No. Now. Now.
All right, other eye.
Now. Now. Now.
All right, so that was cranial nerve number 2. That's intact, so that's good. Next, we're going to do the coronal light reflex. I just need you to stare behind me. I'm going to shine a light in your eyes and see where the reflection of the light is. Okay, light reflection is at 2 o'clock position in exactly the same position in each eye, which is a normal response. Next, we're going to do the diagnostics positions test. This is the test for cranial nerve 3, 4, and 6. I just need you to follow my fingers. Please don't turn your head. Ready? Okay. All right, cranial nerve 3, 4, and 6 is intact. Now I'm going to do the Perla test, which is the test if your pupils are round, equal, reactive to light and accommodation. They are round and they are round and equal. So just going to need you to stare behind me. I'm going to test the light. Okay, I saw that your pupils did constrict. Now just continue staring behind me. Now look at my pen. Okay. Okay, so your pupils they dilated when they looked behind me at the wall, and they constricted when you looked at my pen, so that's good. Now I'm going to go ahead and get my ophthalmoscope and look in your eye. So just continue staring over there. Okay, so I've got the red reflex, I've got the creamy yellow optic disc, I've got the paired retinal vessels, and I see the macula. So we'll go ahead and test the other eye one more time. Okay, I've got the red reflex, the creamy yellow optic disc, the the paired retinal vessels, and the macula. So everything looks good in there. Next, we'll move on to your nose. We're going to test your sense of smell. Just need you to close your eyes. I'm going to close one nostril. Just need you to tell me what you smell, okay?
Alcohol. Alcohol.
All right, good. That was cranial nerve number 1. That's intact. Next, we're going to I'm going to go ahead and ask you to lean back and we're going to look inside your nose. All right. Okay, so I see the nasal mucosa that's red and smooth. I see the middle and inferior turbinates, no discharge, no bleeding, no foreign bodies, no perforated septum. I'm going to go ahead and look in this one, make sure. So we've got no discharge, no foreign bodies, no bleeding, and the middle and the middle and inferior terminates, and your nasal mucosa is red and smooth. Next, we're going to do your ears. Real quick, I'm gonna palpate your ears. I just need you to tell me if you feel any pain or tenderness. Okay. So we've got the pinna.
No pain.
All right, and we've got the tragus.
None.
All right. Now I'm gonna go ahead and look inside your ear. Okay. So I'm gonna start off with your left ear. Your right ear. Your right ear. So sorry, your right ear. Okay, so I'm going to go ahead and pull your pinna up and back. Okay, so I've got your ear canal. I don't see any redness or swelling. I'm going to go in just a little bit more. Got your tympanic membrane being gray, shiny pearl and gray. I see the short process umbo and the malleus. Everything looks good in there. You go ahead and do your other side real quick. Once again, pulling the pinna up and back. Going into the ear canal. I don't see any discharge, no redness, swelling, or foreign bodies. I've got the tympanic membrane, got the short process umbo and malleus. I also see the 7 o'clock reflection of light, and I saw the 5 o'clock reflection of light in this ear. So everything looks good in your ears. We're going to move on to your mouth. First, we're going to test your taste. So I just need you to close your eyes, stick out your tongue a little bit. Tell you, put something on your tongue. Just need you to tell me what you taste.
Sugar.
All right. Well, that was cranial nerve number 9, 10, 7. That was cranial nerve number 7. Also, I got to go back to your ears for just a quick second. I need to do the hearing test, something that I just totally ran by me. All right, so first we're going to do the whisper test. I'm going to go behind you. I need you to close one ear. I'm going to whisper something and just need you to tell me what I say, okay?
Okay.
Close this ear.
ABC.
All right, now another. 1, 2,
1, 2, 3.
All right, so cranial nerve number 8 is in test. Next we'll do the Weber test. I'm just going to hit this tuning fork, put it on your head. I need you to tell me if you can hear it equally in both ears or if one ear is better than the other, okay?
Okay. I hear it equally in both ears.
All right, that's good. That's another test for cranial nerve number 8. That's also intact. Next, we're going to do the Rennie's test. This is an air conduction versus bone conduction. What I'm going to do is I'm going to strike it and put it on your mastoid process. I need you to tell me when you can't feel it anymore, and I'll move it in front of your ear, and I just need you to tell me when you can't hear it anymore. Okay?
Okay. Now.
All right, air conduction was 2 times faster than bone conduction. That's a normal finding. That also means cranial nerve number 8 is intact. Now we can go back to your mouth, and can you open your mouth and say ah? All right, tonsils 2+. We've got the uvula and palate that moved superior So move superior together. That means cranial nerves 9 and 10 are intact. I'm going to go ahead and look around in here just a little bit. We've got the Stenson's duct. We've got the mucosa being pink and moist. We've got the, I don't see a lot of dental caries. And I see the posterior phalangeal wall. I don't see any lesions or lumps on there. Can you touch your tongue to the roof of your mouth? All right, so I see the veins on the bottom of the tongue. I also see the Stenson's duct, saliva is present. Your tongue is roughened with papilli. That looks good. Now I'm going to ask you to, I'm going to test your gag reflex. That's what I'm going to do next. All right, so I'm just going to stick this on your posterior wall. Just need to, okay, cranial nerves 9 and 10 are intact. Now I'm going to ask you to say light, tight, dynamite.
Light, tight, dynamite.
All right, good. Cranial nerve number 12 is intact. Next, we can move on to your neck. So first I'm going to palpate your lymph nodes. So we've got the preocular, postocular, the occipital, the submental, the submandibular, the supraclavicular, the tonsillar, can you turn your head just a little bit and turn your head the other way? The deep cervical chain, the anterior cervical, and the posterior cervical. Did you feel any pain or tenderness while I was doing that? No. All right, well, your lymph nodes are good. I wasn't able to palpate them, which is a normal finding. Next, we're just going to look at your neck. Once again, I don't see any lesions or lumps. Got good skin turgor, which means you're hydrated. Your trachea is midline. Now I'm going to go behind you and try to palpate your thyroid gland. So I just need you to lean forward and to the right. All right, and swallow for me. Now to the left and swallow one more time. All right, that's good. I felt your thyroid tissue move up when you swallowed. I wasn't able to palpate your thyroid gland, which is a normal finding. It's nothing to be worried about. Next, I'm going to assess your carotid arteries. And on this side. All right, carotid arteries are equal bilaterally 2+. Now I'm going to listen for bruits. Normally none are present, so hopefully we won't hear you. I just need you to take a deep breath, let it out, and hold it. One more time. All right, no bruises were present. That's a good sign. And we can move on to your chest. So the first thing I'm going to do, actually I'm going to go ahead and take care of the rest of your pulses real quick. So I'm going to go ahead and check your radial. Okay, radial pulse is 2+ equal bilaterally. Got your brachial pulse. That's also equal bilaterally 2+. And go to your posterior tibial. 2+ equal bilaterally. And finally, your dorsus pedialis. That's 2+ equal bilaterally. All of them sound really good. Now we can actually move on to the chest. I'm going to go ahead and listen to your heart sounds. So you can listen to those. I'm going to have to go up under your shirt, so just be warned. Okay, so we've got the aortic, which is on the second right intercostal space. And we've got the pulmonic, which is the second left intercostal space. Okay, we've got the tricuspid, which is the lower left sternal border. And then we've got the mitral, which is the fifth left intercostal space at the midclavicular line. Okay. I heard your heart sounds. S1 was heard in the apex, which is in the lower part. S2 is in the base, which is in the top part. No murmurs or extra heart sounds were heard, so that's good. Now I'm going to move on to your breath sounds. I'm going to go ahead to the back. First I'm going to check systematic chest expansion. So I just need you to take a breath All right, good. My thumbs moved outwards equal bilaterally, so that means you have good chest expansion. Next, we're going to do tactile affirmative. So I'm going to put my hands on your back, and every time I need you to say 99, all right?
Okay. 99, 99, 99, 99.
All right, so actually I heard vibration in all the spots, which is good and normal. Next, we're going to go ahead and percuss your chest. I'm actually looking for resonance to be heard in the lung fields, so I'll go ahead and do that. Okay, so I heard resonance in the lung field. That's good. I'm going to go ahead and listen to your breath sounds now. So every time, let me turn my finger around here. Every time my stethoscope moves to a new location, I just need you to take a deep breath, okay?
Okay.
So your breath sounds sounded normal. I didn't hear any extra adventitious sounds. So that is good. Now we can move on to, I'm going to go ahead and listen to your breath sounds in the front. For this, I'm actually only going to listen to these spots up here. Normally, I would listen to the rest of the spots on the chest, but since you're wearing your shirt, I won't make you take it off. I'm just going to listen to those two. Deep breath. Deep breath. All right, that's good. Breath sounds were normal on the front. No adventitious sounds were heard. So we can move on to the abdomen. So for this, I just need you to lay down. I'm going to let this out so you can pick it up. So the first thing I'm going to do is inspect your abdomen. We pull your shirt up just a little bit. All right, so the first thing I'm going to do is inspect your abdomen. Your contour is flat. I don't see any lumps or lesions. Your umbilicus is midline and inverted. I don't see any crusting or redness or swelling or anything with the piercing. Do you have any pain or tenderness with your abdomen anywhere?
No.
All right. Well, the first thing I'm going to do is go ahead and listen to your bowel sounds. These are high-pitched gurgling sounds. They're unregular. Listen in all four quadrants, and I'm going to start with the right lower quadrant and work my way around. Okay. Bowel sounds were heard in all four quadrants, those high-pitched, unregular sounds. Next, I'm going to go ahead and listen to your vascular sounds. I'm listening for any bruits, usually none are present. So go ahead and do that real quick. Okay, so we've got your aortic, your renal, your iliac, and lastly your femoral. That's good. I didn't hear any bruise, which is normal. I do see the pulsations from the aorta right up here, which is okay. The next thing I'm going to do is go ahead and percuss your chest. I'm just looking for tympani in the gastro areas and dullness in the organs such as the spleen and the liver. So so I was able to hear tympani in the gastro areas. and dullness on the liver and the spleen. So the next thing I'm going to do is go ahead and do some palpation. First, I'm going to do light palpation. This is just a check for the muscles in the in your abdomen. So just let me know if you have any pain or tenderness.
Okay.
No pain or tenderness?
None.
Okay, now I'm going to go deeper, check for enlarged organs. Once again, if you have any pain or tenderness, just let me know. No pain or tenderness?
No.
Okay, I didn't feel any enlarged organs, but I'm going to go ahead and check for your spleen and liver just to make sure. Your liver is on your right side, so go ahead and check that first. Can you breathe in for me? Okay, your liver was not palpable, which is okay. It's usually not. So I'm going to do your spleen real quick. One more time, breathing in. Okay, and once again, your spleen wasn't palpable either, which is okay. That's fine. So now we're done with your abdomen. Go ahead and get you to sit up for me. All right, while you're sitting down, I'm going to go ahead and test your muscle strength. For your arms, I'll just wait until you're done. Okay, for your legs, I'm going to need you to flex and or pull and push against my resistance. So go ahead and push, all right, and put, all right. So your muscle strength on your on your legs are 5+, so that's good. Now put your arms like this. All right, now pull and push. All right, muscle strength is 5+, that's good. Now if you'll stand up, we'll go ahead and do the range of motion. Okay, so first I'm going to put my hand on your neck just to check for any cupitis or anything like that. I'm going to go ahead and start with your neck. So I need you to flex against your neck and hyperextend back and lateral bend to the right where you touch your ear to your opposing shoulder, to the left, and then go ahead and do rotation. Yep. Any pain or cupitis?
None.
All right, full range of motion in the neck, and we'll go ahead and check cranial nerve number 11. Serve your shoulders. All right, and rotate your head. All right, rotate your head. Cranial nerve 11 is intact. We'll go ahead and do your arms next. So go ahead and we'll do your shoulders. We'll do your shoulders next. So go ahead and we're going to put your hands over your head, abduction, lower them, adduction, put them out beside you, and rotate them, circumduction. Any pain or tenderness?
None.
Okay, now we're going to do internal rotation where you put them behind your back. There you go. External rotation behind your head. All right, and hyperextend them behind your back. All right, and any pain or tenderness there?
None.
All right, full range of motion on the shoulders. Now we're going to go ahead and do the elbows. Just put your arm out. We're going to flex and extend. Okay, do it one more time. There you go. Now turn your hands in, put your palms down. That's pronation. Put them up. Supination. Any pain or tenderness?
No.
All right. Well, then that means that you have full range of motion in your elbows. So now we're going to go ahead and do your legs. I'm going to do these one at a time.
Okay.
We're going to go ahead and start with your knee. We're going to do the same thing with your muscle strength. Just need you to flex and extend. All right, that's good. Go here and do this one real quick. All right, flex, extend. All right, that's good. Full range of motion in the knees. Any pain or tenderness?
None.
All right, now we'll do the ankles. Gonna come down here. All right, toes to the floor. That's plantar. Toes up. That's dorsiflexion. Turn your foot inwards. That's inversion. Outwards. That's eversion. Do it one more time over here real quick. Okay. All right. To the floor. And to the ceiling. All right. And inwards. And outwards. All right. Any pain or tenderness?
None.
All right. Full range of motion on the ankles. Okay. So next we're going to do some cerebral functioning tests. So first we're going to do the Tandberg walking. I just need you to walk heel to toe for just a few steps. Well, go ahead. All right, now can you do it backwards? That's good. Now we're gonna do the Romberg test. Just need you to stand with your hands at your side. Close your eyes. Just need you to balance. For 20 seconds, okay? You were able to balance. There was just a little bit of swaying, which is normal, meaning you have a negative Romberg sign. So next we're gonna do a coordination test. I need you to touch your nose. All right, I'll touch my finger. There you go, touch your nose and touch my finger. All right, coordination is good. Next we're gonna do a sensory test. First we're gonna do the graphesthesia test. I'm gonna ask you to close your eyes, hold your palm out. I'm gonna draw a number in your palm. You just need to tell me what it is.
0.
All right, that's good. Next we're gonna do the stereonesis test, which is where I'm gonna ask you to close your eyes again. Hold your palm out. I'm gonna give you an object, and I need you to tell me what it is.
A key.
That's good. Your sensory system is good. Now I'm gonna test your reflexes. So first we're gonna do the biceps. And I'll have to do these one at a time. Okay, that reflex is 2+. Do this one. Okay, so biceps reflexes are equal bilaterally 2+. Next we'll go to your triceps. Just let it hang down. There we go. That's good. One more time. Just let it relax. There we go. All right. Triceps are reflexes are 2+ equal bilaterally. If you want to have a seat, I'll go ahead and get your patella and your Achilles. Okay, so for your patella, that's good. All right, patella is equal bilaterally 2+. Now we're going to go to your Achilles. All right. All right. Achilles tendons are 2+ equal bilaterally. So I think that concludes our exam. I'm going to go ahead and look at my notes to see if we missed anything. Did you have any questions for me?
None.
Give me one quick second. Okay, well, it looks like that we covered everything, and that completes our general head-to-toe assessment. Thank you for being a nice patient.